because congenital heart disease defects doesn't only affect, it affects when the child is born, but sometimes it doesn't get detected until the child is much older. Have you had any issues when the child is like much older, not when it's in infancy? And does that create even more complications?
Oh yes, certainly. It's okay. There are this thing happened. That is partly is the way the child is being brought up, and partly is because of the resources of the country, and partly also because maybe the medical attendants not be able to detect it. There are multi reasons for that, but we have actually one of the common conditions that often that are being missed in childhood and detected only in adulthood is atrial septal defect, meaning that the hole between the two upper chamber of the heart. Atrial septal defects is one of the common hole in the heart, and we have seen people who are in their teens, in their adulthood, in the middle life, or even in their old age, they're coming with huge hole in the heart, and they have been well, they have been apparently well without realizing that they have actually serious congenital heart disease. As you say that what impact they have on this, of course, it shortens their lifespan, it reduces their quality of life. Like people who have large hole in the heart, atrial septal defect, if they are detected in late adulthood, the lungs will probably be damaged. The heart is so dilated, they kind of predispose them to abnormal heartbeat. So that would be the one of the examples.
So it's so interesting, because when you sit down and you research about congenital heart disease, you realize it doesn't only happen to infants. People go throughout their whole lives without knowing there's something wrong with them.
Some of them, yes, but increasingly rare now.
Yeah.
Because as I told you that obstetrician detect them, pediatrician look out for them, and even though they miss out with those pulse oximetry, people listen to their heart. They're increasingly getting rarer and rarer, especially in this country.
How do you say, how can you say about the treatment part? Do all congenital heart defect patients, do they all have, after they go through treatment, do they all have a proper life, or they still can't enjoy a normal life as such, and things like that?
Well, treatments are divided into category depending on the nature of the lesions. So we have curative treatment. Giving you an example, that if you have an extra blood vessels in the heart, we call it a patent ductus arteriosus, or PDA in short. You ligate, you tie it off, or you use a device putting into the heart without surgery, you block it off, you cure the child. So that is curative.
So not all treatments are surgery?
No, not all are surgery. You have a hole in the heart, a ventricular septal defect. You have a hole in the heart up there called the atrial septal defect. You can either put a device in and close it, or you can have surgery to close it depending on the need. We won't go into those details, but those conditions, once you close the hole, and if you do it at the appropriate time, not at, like, for example, in adulthood, then you cure the person actually. So those are curative operation. But there are those who actually are corrective operation. You correct those but then sometimes you leave behind something. Inevitably. I'll give you an example. There's a very common condition. We call it tetralogy of Fallot. Tetralogy of Fallot means that conditions of the heart, they have four things. Tetra meaning that they have a hole in the heart. Secondly, they have a blocked vessel to the lung. And third thing is that the blood vessel that's coming out of the heart going to the body, we call it aorta, is supposed to be entirely coming out from the left side, but it rides in the center. Partly from the right, partly from the left. That is the third thing. And the fourth thing is that as a result of the blockage of flow to the lung, the right side of the chamber called the right ventricle is hypertrophy, very thick. So that actually
one problem,
yes, four problems. Wow. So we can correct it. We can close the hole, we can make it big, the blood flow to the lung can make it big. But some people, they are born with very small blood vessel to the lung in tetralogy. So during the surgery, inevitably the surgeon has to cross over the door, and in the process that the valve is destroyed in order to create a patent and unobstructed flow. So these people will have something left behind, a leaking door. And this leaking door, after 10, 15 years, or sometime earlier, sometime much later, the leaking of the door can create a situation where the right side of the heart become more and more dilated. And when that happens, then you need to have surgery again in order to correct that. So that is corrective. But there are also conditions who are palliative. Palliative meaning that you cannot completely correct the whole thing, especially a situation where there's only one single chamber of the heart. So you go through a series of operations, and this series of operations will tend to prolong the life and improve the quality of life. But nature is such that God has made the heart in a certain way to last a certain period of time, but human trying very hard to prolong that and to make use of whatever abnormality there to sustain a long duration of life, then it is not perfect. So these conditions are not corrected, even they are just palliated to prolong life,
So it's just a question of sustainability.
to improve the quality of life. That's all. Yeah.